Welcome back, everybody, and from Gulfstream Urology, we want to welcome Dr. Alejandro Miranda Sousa. Good to see you.
Thank you, Bill.
Glad to have you back here on the old yellow love seat to talk today about bladder cancer. This sounds serious. If you hear bladder cancer, always horrible news?
Not necessarily.
Okay.
So the bladder is an organ that the main purpose is to store urine, and when the time is right, empty it. The lining of the bladder, called the urothelium, is usually where the cancer will form, and it's just increased in the rate of growth of these cells. And what happens is they will form tumors. These tumors present in different ways. Usually, thank God, the majority are very low-grade tumors, and these tumors could be approached in a more conservative way. They are under a microscope, they are like low grades and high grade tumors, and usually there will be an important differentiation to see how these tumors are going to do down the road. The second type is the more flat sessile tumors that usually come to be more aggressive and more dangerous for the patient's life. There are also multiple risk factors for this. The risk factors include smoking. Mm-hmm. Extremely important. 4 to 7 times more bladder cancer will develop in patients that do smoke.
4 to 7 times
more.
That's substantial.
Absolutely. So it's a major risk factor. The other risk factor will be obesity and certain diets, certain for example, patients that have been working on plants that process rubber, on paints,
chemical
exposure
that are used in these kinds of manufacturing facilities.
Correct, and pesticides.
Okay.
Some chemotherapeutic agents could increase the risk of that.
You're great on television, not only because you look good on television, because you work good with pictures that we like to show. Let's take a look at some of them. How big is the bladder, by the way?
The bladder could hold in a normal situation around 10 to 12 ounces. So
okay.
Most
people about the same size bladders, because you always hear, oh, your bladder is bigger than my bladder and all that.
Some people, because of certain conditions, could actually hold more, but not necessarily.
What are we looking at?
When we have symptoms, and symptoms are not very common, but if you develop blood in the urine, for example, that is 80% of the tumors will develop some form of blood at some point, microscopic or macroscopic. We do an evaluation in the office called a cystoscopy, and this is a schematic picture of this. And it's a flexible scope. It's very, very small. It's done in the office. Takes around 1 minute to be done, and you can find tumors like in the insert there. And those are the typical tumor that appears to be a polypoid papillary tumor. Looks like a broccoli or a wart. And those are the typical tumors, the typical appearance of the low-grade tumors. We have a second picture that will show different views of different kind of tumors, and you can see again, looks like a broccoli kind of.
It does. Good description.
Yeah. So they usually are what we call papillary tumors. They're the most common. 70% of tumors who come in that presentation. There are some others that will be more kind of a red patch, velvety looking, and those sometimes could be of more concern. Imaging studies are very important. You can see there in the bladder, all the dark, bigger circle is the bladder. You can see a big tumor, and sometimes that could be the size of a ping pong ball or golf ball here in Florida with the arrow. So imaging studies are extremely important. That's why a CT scan or IVP or ultrasound are important during the evaluation for this. It has an ultrasound. You can see the dark circle in the middle is the bladder full of urine, and you can see on the on the right of the screen a little area that is small, a very, very nice catch on ultrasound.
Is that one of those polyps again?
A polyp again. So that's imaging extremely important to try to see. So then we do get to the time that we need to see what kind of tumor it is, how it looks in the microscope, and we see a tumor there, it looks like a broccoli or something. You are resecting. That loop is used to resect and stage the tumor. When we have this tumor removed, we do this usually endoscopically with a little telescope, and we kind of grab the tumor from its base and remove it, and we can cauterize at the same time. And the treatment will depend on how these look in the microscope and the staging. So you'll see the next picture shows the staging of tumors. And starting on the top, you see TA is very superficial. The roots of the tumor are very, very shallow. T1 a little bit deeper into the wall of the bladder. And T2 and T3 go into the deeper muscle layer of the bladder that start to be very concerned. And the tumors could be treated either from simple resection, and that's it, and continuous surveillance, versus a possibility of chemotherapeutic agents and even removal of the bladder. So staging is very important. If you see abnormality in your urine, go to your doctor and be sure that this is checked.
Prevention,
Prevention.
stop smoking, better diet,
lose some weight, exercise.
all of that.
All of that.
Which are a couple of things that you actually advocate for people even after a cancer diagnosis.
Absolutely,
right?
absolutely. Because even if you are a smoker and you have the diagnosis of cancer, even the surgeries might be much easier if you stop smoking. So it's very important.
Thank you so much, Dr. Alejandro Miranda Sousa. We appreciate your being here.
Thank you for having me.
You're welcome. Thank you so much. If you want information about him, about 21st century oncology, or Gulfstream Urology, just go to our website, and there it is right there looking at you. It's fox4morningblend.com.
Up next, Condo and HOA Law Group is back. Why they want you to turn your attention on satellite dishes. Stay with us.